Hi there, I'm Wes Roberts. I'm the publisher with SRQ Magazine. I'm the host for today's In Conversation With. And today we are talking with Dr. Danielle Babb, who is a physician with the Ramos Center for Interventional and Functional Pain Medicine. She is here as part of our Perspectives in Medicine series. So I'm going to welcome Dr. Babb. Thank you very much, Dr. Babb, for being with us. Do you mind if I call you Danielle?
Absolutely not. Thank you so much for having me.
My pleasure.
The practice I am a part of is the Ramos Center for Interventional and Functional Pain Medicine. Our focus is primarily doing interventional new techniques to treat chronic and acute pain. And we also offer a way of other therapy options, such as medication therapy, addiction treatment, psychotherapy options, and physical therapy as well.
And so I think the thing that's always interesting to find is what drew you to this practice, not to the practice, but to this speciality.
Absolutely. So growing up, both of my parents were actually chronic pain patients. My mother injured herself at work as a nurse. She herniated a lumbar disc. And my father, shortly thereafter, injured himself at work, falling off a ladder, doing construction. So through my adolescence, I used to bring both of my parents to their chronic pain physician's office for interventional procedures. And the pain physician they saw became a mentor to me, and he helped both of my parents recover significantly. My father went back to work shortly thereafter, and my mother, she became unfortunately disabled from her injury, but she is very functional. She travels, and she has a much better quality of life than she did 3 years out from her injury. So he was really a mentor towards me and kind of brought me to the specialty.
And I think, right at the front end, it's probably fair to say that in the last couple of decades, pain medicine has gone through a tough time PR-wise.
Absolutely.
And so I think the most important question is, what's changed, what's improved, and what did we learn from what I would probably call the opioid period, but
Absolutely. So that's an excellent question. It's one of the things that drew me to the specialty as well. The opioid pandemic is still a war we're fighting, but it is something that innovatively changed this practice and has shaped and created new fascinating techniques that we've never seen before. Minimally invasive techniques that we can use to treat a variety of different pathologies, including spine ailments, cervical pain, and also other different orthopedic injuries, just to start. And it's going to continue to expand. I mean, just the fact that, the patients that can no longer be effectively treated or do not want to take the risk of being on medical therapy, we have so many other treatment options to offer them. And, all it takes is for them to come in and get an evaluation, and we go through all the different things we have to offer at their visit and give them the opportunity to undergo and try some of them out.
I think what you started to describe there would help people a lot to imagine the process. If someone is confronting chronic pain, they're usually desperate for help, but also pain can be an impediment to acting, to help yourself. What is it like when someone who's suffering from chronic pain comes in the door, and what are those initial steps?
Absolutely. So patients suffering from chronic pain affects not just the person, but also their family members. It affects their loved ones, and it's completely it can be completely debilitating depending on what they're dealing with. And so the typical patient that's been dealing with that amount of suffering for so long, their first couple of steps, we see, them come through the door, and you can see it on their face, you can see it on their family members' faces. They're tired. They feel like nothing is going to work. Maybe they've been neglected. They've failed. Usually at the time they come to us, they've failed so many different other options, whether they've seen a pain physician or a surgeon, or maybe just their primary has sent them for physical therapy or medication therapy. They feel like everything has failed and nothing will work. So they feel discouraged. And you can see it on their face when they walk in. When they walk into our office, they're greeted by our front desk staff who takes who takes their information. They have a seat in our lobby. They can pick up at that point pamphlets and watch videos on some of the interventions that we perform and that are offered. And then they'll come into the exam room, and they'll be greeted by one of our medical assistants who will go through a very focused comprehensive history, reviewing all the records, that the prior treatments they've had done, what's worked and what hasn't, if anything. And then they'll meet the physician.
Are there particular fears that a new chronic patient comes in with? Is there a small subset that you just hear over and over again?
Yeah, nothing works, and or I'm on medication that lasts maybe an hour, and then my pain is severe, and I'm afraid to stop the medication because nothing else has ever been as successful, but the medication isn't effective. I can't get my medicine sometimes, as the opioid epidemic has changed the way physicians prescribe medication as well. And so you just see that fear and that frustration on their face. And our goal, especially when we first meet a patient, is just to comfort them, understand what they're going through, and then break down what is the pathology and what is going on, and then offer them the treatment plan and algorithm. And it's more of an open discussion and forum as to what patients are comfortable trying as well. And to educate patients and their family members of what options are out there, starting with the least invasive, most conservative approach to more aggressive options if and when those fail.
And so what are the sorts of treatments that are, I want to say cutting edge, but more important, working? What are the treatments that work?
So that's a fantastic and exciting question. It really depends on the pathology, but there are, as I said before, I really enjoy going through this algorithm with the patients, telling them, laying all the cards out on the table. These are the steps of everything I can offer you, starting with the things that are least invasive, being maybe just therapy or a very directed form of physical therapy, to medication therapy if they're interested in using that as an adjuvant, to more aggressive things like injections, sometimes surgeries, minimally invasive surgeries, sometimes implantable therapies, spinal cord stimulation or intrathecal pumps. So there's lots of different treatment options depending on what's going on. We see orthopedic injuries from acute inflammatory conditions to chronic spine pathology. Maybe patients have had surgery or they haven't. They're trying to avoid surgery. So we definitely treat a vast array of conditions. So there's not just one algorithm, but there are very effective and safe, minimally invasive techniques that are available, and they're continuing to be developed. So it is an exciting time to be in interventional pain medicine. I think we're really making strides in helping patients and getting patients back to doing what they love, whether that's golf or traveling with their spouse or significant other, spending time with their grandchildren. That's what our goal is. So
I was really interested when you were talking about seeing not just the face of the patient, but seeing the rest of the family. And I have to assume some of that has to do with your own personal experience, having
Absolutely.
been a caretaker, if that's an appropriate term, for what you were doing when you were young with your own parents. Can you describe what that's like for those people, a little more detail I guess just to address that there are people who understand what it's like to be a caretaker for someone in pain. Mm-hmm. Can you speak to that a little bit?
It's very challenging because you see your loved one suffering, and a lot of times the family member or spouse, they even can become extremely frustrated and angry at the healthcare system, whoever they think is failing their loved one, whether that be the medicine that's not working enough or wears off too soon, or the difficulties that they may face to get the workup, the diagnostic workup, the imaging. And so frustration and anger are sometimes emotions we see in loved ones. And here to try to address those as well. I always tell patients to bring your family member with you to your visit, because I wish I could tell you how many times I hear, you got to write all this down because my wife is going to ask all these questions and I need to have the answers to them. And I always tell them, bring your significant other, bring your family members, bring your children, because that'll help kind of make a cohesive plan. Just because the patient has an understanding themselves, they don't know how to answer all the questions that may come from their family members. So that's a way that we get them involved. And so I think that we address their concerns as well at the visit, and that's why they're encouraged to come. If not at the first visit, but then future visits, absolutely.
Thank you. Changing gears just a little bit, what is it like being a female physician? Does that influence your experience and your professional journey?
Absolutely. I think I definitely experienced a vast array of different training environments through my anesthesia residency. My background is in anesthesia. And so while I was doing my training in University of Miami there, it's multicultural in Miami, and definitely the specialty for anesthesia is it has both genders, obviously. But in interventional pain, I did my fellowship at University of Kentucky, so all of my colleagues were male, and that was a different experience, but encouraging. I never really felt discriminated against or anything like that. I will say that women in interventional pain is a much smaller margin, but I think that it gives. I think as being a female gives me an understanding for certain pathological states like female pelvic pain or just some conditions that some of my male colleagues are just not as well versed in naturally. So I think it gives me a different perspective, and I'm excited to be doing what I do. I find it challenging and stimulating, and nothing really but complete support from my male colleagues. Absolutely.
That's great. Are there ever patients that seek out a female pain interventionist because of the gender correlation, the things you were just talking about?
Absolutely. I mean, in that previous example, pelvic pain is something that is uncomfortable, not just from the pain perspective, but just dealing with the social anxiety and kind of emotional stress related to that. And so I have many patients that are seeking a female physician for comfort. Some of the other specific requests for a female physician are ethical, like religious patients that prefer female physicians to discuss their medical problems with. But beyond that, I mean, I have male and female physicians that are like, oh, I have never had a female pain doctor before. And I'm like, well, believe it, there's some of us out there. But I'm not the only female physician in my practice. There's also a Dr. Lindsay Shoyer who's been practicing a long time in this community, and she's wonderful. And we have discussed some of these patients we see, and we share some of these patients together. So if anything, it's nice to be, maybe we may be one of the few female pain physicians in this community, but we're able to provide that to patients.
And I guess probably one thing for me, we're coming to a close probably here on our discussion. I could talk to you for much longer, but they're signaling me from off camera, telling me I have to wrap it up. They know that I'll just go and go, given the option. They know me. I think where I'd love to finish, because it really would be great experience, is to hear about what it's like for you when you have someone that you've just really helped. Anecdotally, what is that like? How do they react? How do you feel? Tell me that story.
Absolutely. I can think of many patients that you just figure it out for them. And they are so grateful. They don't even have to say anything. The moment you do an intervention, interventions, it's like instant almost. At times we do a procedure and we can tell that's the nerve or that's the spot. And the patients have this sense of ease and relief over their face that's just almost immediate. And it's so satisfying for a physician to say, well, we know what the problem is now, so we can further investigate this and focus our treatment here. But for the patients, I mean, to take their pain that's a 10 out of 10, limiting their ability to live their life down to a 1 out of 10 or a 0 out of 10. I mean, for some patients, I mean, that's life-changing. And, you know, to see our patients that are debilitated, unable to walk, unable to go to the grocery store, now traveling, going to Europe, you know, it's incredible. I love what I do, and I wouldn't do anything else.
Well, that's amazing. Thank you, Dr. Babb, so much. Thank you for joining us, and thank you for joining us for an In Conversation podcast discussion. We will see you at the next one.